Oxford has just published a paper that has found that government grants reduce the risk for teenage girls to contract the HIV virus. Can you please tell me about the research you did on this?
Well, for a start, it certainly wasn't just Oxford. I'm also at UCT, and we worked with WITS and with UKZN, and with the South African government and with UNICEF and PEPFAR. So it was a massive team effort to try and do this. But really, I think where this came from was several years ago, we were working with government, and particularly the Department of Social Development and Health. And we were saying, what kind of questions do we need to ask in the next 5 years that are going to help inform our policy and our programming with children and young people? And one of the big things that keeps coming up is that we don't seem to be able to crack HIV prevention in this young group, and we're not quite there yet. A recent meta-analysis of behavioural programs wasn't really finding strong effects. So we need to do more for this group. So we charged off with over-optimism about how easy it was going to be, and went to do a massive national longitudinal study of young people in our country. And basically what we did was pretty simple. We picked health districts, urban and rural health districts in 2 provinces, and then we randomly selected census areas, and then we interviewed every single household with a child in it in those areas. And that was to make sure we kind of got everyone. We didn't just get the kids in school, and we didn't just get the people who were already getting a service like health services. We really kind of got everyone, except for one village that flooded, and we couldn't get there in time.
Oh, jeez. And do you know how many people you interviewed?
Well, in the longitudinal study, we interviewed 3,500 children. And then a year later, we went back and we got 97% of them again. In the whole study, we interviewed about 10,000 people because we were interviewing their parents, we were interviewing a whole nother province. It was a really big national effort to try and understand the needs of children in our country.
And can you tell me about your findings?
Well, we found a whole range of things, and a lot of the things that we found were about the needs of children whose parents had HIV and whose parents had died of HIV/AIDS. And we found that those kids are really, really battling. They've got 2 to 3 times the levels of child abuse and maltreatment. They've got double the levels of extreme poverty and of not having enough to eat. They've got double to treble the levels of stigma and double, trebled levels of disability in the home. So that was one of the big findings. But the other thing that's really just come out, that came out this week, was much more hopeful. And that was starting to look at what might help, what might be improving things for kids in our country. And we went back and looked at our good old child support grant and our foster care grant that so many people feel is not a helpful thing in our country. And we really found quite the opposite. What we found was that girls in families where they get the child support grant or the foster care grant, because you can't get both at the same time, were only half as likely to have transactional sex as girls who didn't get it. So half as likely to have sex with someone in exchange for food or school fees or a bit of money to live on. And they were 2/3 less likely to have a much older boyfriend, 2/3 less likely to have a sugar daddy than girls who didn't get the grant. And these are 2 of our greatest risks. I mean, our health minister said last year that sugar daddies were one of our greatest risks for our teenage girls today. And I think this is such encouraging news.
And Linda Gale, in your experience, have you found that the teenage girls you work with have transactional sex?
So Jennifer, I would say that it definitely is one of the risk drivers. I think, this is complicated, and it's important that we don't latch on to just one idea and think, okay, sorting this out will eradicate the HIV epidemic. On the other hand, I already spoke about the pieces in the puzzle, and I'm very excited that I think this is another key piece in the puzzle. I want to refer you to a fantastic set of prevention papers that came out of the very same journal, The Lancet, a couple of years ago, and the author of this was Tom Coates. This particular paper I want to refer to, and he adapted some work from King's Holmes, who said that we should really think about prevention as multi-pronged. So we need the biomedical, and definitely I spoke about the exciting research that's happening in that regard. Female-controlled methodologies, for instance, microbicides, pre-exposure prophylaxis. But we mustn't forget about behavior, when we've already spoken about that, but very important structural interventions that might make a huge difference in people's lives. And I think it's likely that we're not going to find one, panacea that sorts this out. But I think this work that Lucy and others have done, and there is other research that I think is really adding to the understanding that if we address structural components, and in this case it's poverty or the need that people have for things, not necessarily just money, but consumables, material things, that if we address that as well, we may in fact move ourselves towards having a risk-free environment.